Please like, share, and subscribe.
Hey, I'm Antoine Coleman,
I'm Jessica White.
and together we make up Team Tissue Enhancements. Who are we? Personal trainer,
I am a registered massage therapist.
and in addition to personal training and massage therapist, we have certifications and just weird fun stuff. Weird fun stuff dealing with the body.
Yes. Lots
And,
of body work stuff.
And what we do is we do a number of things. We help with pain management. We help people with resourceful exercise. We help with movement proficiency, prehab, rehab, and also injury prevention.
Yes. Everything that he said.
It all ties together.
Yes, and it all ties together. We incorporate our piece depending on what case we have. We have different cases every day, and we just try to implement these tools that we're getting ready to talk to you about into the cases that we have.
Let's see, we started off February 2018 when we went to California. We met up with two doctors over there, and they taught us a vibration system by HyperIce. I just want to thank you to Dr. Mike, Dr. Sharon. Always, we're going to thank you guys forever. You did a lot for Jessica and I. You don't even know. But you guys gave us the blueprint, and we're just going to do what we do here on the East Coast, and you guys have the West Coast.
Yes, absolutely. We try to stay up on a lot of the latest trends as far as technology and just different modalities, because recovery and exercise is always evolving, and we just try to stay up on everything as much as we can so we can bring the best results for our clients.
Current trends, you got to stay up to date.
Yes.
Alrighty, so we go. Let's do the cup first.
Okay.
So one of the modalities that we do for our clientele is cupping.
Yes.
Let Jessica explain the cupping.
I love the cupping set here. Cupping is a very ancient form of. It's a very ancient form of modalities related to massage therapy and holistic healing. We use this in specific cases as far as decreasing inflammation, circulation and blood flow, and things like that. We have all the pieces here, just depending on what body part and what your case may be as far as your restriction, as far as whatever may be in your body that you may need help with. This is one of the tools that we have, and it works very effectively. There's no real risk as far as doing that. It's just, you may get like a little swelling or, bruising from inflammation, things like that, but nothing very major. And it also pairs well with some of the other tools that we have in order to get you the best results.
Another one of the tools that we have Rock Blades. As a certified functional movement technique specialist through Rock Blades, I get to use these fun tools, toys, whatever you want to call it. As you can see, they kind of look like brass knuckles. One is heavier than the other, but they do awesome things. Then we have this piece here. Instrument assisted soft tissue manipulation. So what I do is I can use one of the many devices depending on the case and just manipulate the tissue. This helps alleviate pain first, and then allows you to get deeper into the root of the issue rather than staying so superficial. Great tool, expensive. Took the course about 2 months ago. I use them daily. And it's one of the many modalities that I use when I have a client with me. So what do we have next, Jess?
Next, we have a little extension of the soft tissue manipulation tools. I purchased these grafting tools. There are a few of them. I'll show it to you on here. There are a few different soft tissue instruments here that we have that are able to go with The grafting technique. So grafting is a new, relatively new form of manual therapy that has been used for years, but it's relatively new coming up with us as far as recovery. We use these as soft tissue manipulation tools to get deeper within the tissue, as Antoine just mentioned with the rock tape. You see they have different points on them. They have different features in order to get down into like the creases and crevices of body parts such as ankles and elbows and neck and all that kind of stuff. So it's a little variety, and we use them daily. As our logo mentions, it's deeper than you think. A lot of our cases are deeper than what people think, and it's not just superficial body, it's everything that's inside and everything that you really have to take care of in order to maintain that functionality of muscle and soft tissue. So those are the tools that we have. What we got next?
What do we have next? We have the Normatec compression pants. All the professional athletes use the Normatec compression pants. What is it? It's just an massage extension. We have five zones. The Normatec pants scientifically fills up each zone with air to create a massage. And what it does, it helps eliminate the waste that we may break down via using some of the instruments, or if a client can just come in from football practice, basketball, or just heavy usage of the lower extremity, we could put them inside the pants, let the pants do what they do. They're gonna come up with fresh legs faster. That's the name of the game with Normatec. We have the boots, we have the hip attachment, arms coming next, and last up, what we have these vibration tools. I'll let you use this one here, Jess, and I have this one here. Actually, Jess, let me get that back. We want to compare and contrast the two.
Compare and contrast.
So what we have both of these products are made by Hyper Ice. First up, we have the Hyper Ice Raptor. Then we have the Hyper Ice Hypervolt. You see my Hypervolt is kind of beaten up. I had it for quite some time. So what are these devices? They are percussion devices. Some people say vibration, but the actual term is percussion, and percussion is just vibration. So you turn them on with the Raptor, you press the button, or you can hold the button and let this rev up. On this one, you flip the switch at the bottom and it has 3 different speeds. This has 6.
Yeah, I get it.
The Hypervolt, it percusses 3,200 beats per minute. So within 1 minute, this here is pounding 3,200 times. But on the highest level, with the Raptor, it goes 3,600 beats per minute. Awesome devices. They can be used in quite a few ways. They can be used as recovery. They can be used as a form of rehab, and then extensive rehab and prehab. The Raptor basically touch bone. It gets as deep as you want it to get. What it does is it's myofascial release on steroids. This is foam rolling on steroids. What it takes for you to accomplish with one foam roller, if you want to accomplish something that we do, it might could take a week, maybe longer. But when using the Raptor, 30 seconds tops. 30 seconds, maybe less than that. I'll say 3 strokes. The Hypervolt, we can, if this takes 30 seconds, this may take a couple minutes compared to a traditional foam roller that's going to take weeks. We use these 2 devices to help with injury. Thank you, Dr. Mike, once again. And I'll tell you, this right here, it's heavy too. But all the top places, top recovery centers should have this. If they don't, I know Tom Brady guy uses this. The folk down at DBC in Miami, Florida, they use it. And we do hair tissue enhancements. You gotta get approved for this. Can't no average Joe just buy this. People get denied every day, B. That's some of the vibrations technology that we have. There's plenty more where this came from. We have hyperspheres, we have venoms, we have back braces, elbow, shoulder. It's just a lot. Recovery's taking over. People want the body. They do whatever to achieve the body, but the body has to repair itself. That's what people don't have the knowledge, and that's where we come in and we educate you. Our biggest thing is education first, and then the recovery second. Got anything to add, Jess?
Just to piggyback off of what you said, just like I mentioned before, our logo is deeper than you think. We take a look at what's really further inside of you. I mean, from past injuries, trauma, anything like that. And we also specialize in different modalities that deal with just those aspects of your life in general, that could help you progress in exercise or movement or just relaxation, period. Recovery is definitely evolving, and we are here to take it over and work as best as we can and provide clients with the best results.
All right, so I was going to take you to the wall.
Oh, okay.
Yeah, so as you switch it over, here we have our our activity wall. You see we have hooks. I have 9 hooks up, 3 different places. Yeah, so here we have our activity wall. Activity wall, we have 9 hooks. The hooks are in 3 different places. So for example, we have a TRX strap, we have a bungee cord that could go in the middle around the waist, or I could put it at the bottom to go around the feet. I use the wall for multiple things. A lot of my older population who have difficulty in doing certain movements, I had them use the TRX strap to assist them. So say I may have a client who is 60 plus years old, and they may need to learn how to squat. So I just had them use the TRX. I teach them form and everything through here, and we work. But one of the biggest things for me and my clientele is that I understand the myofascial slings within the body. Shout out to Tom Myers. So I do a lot of functional patterns. The world is just becoming hip to functional patterns. I've been doing functional patterns since the end of last year. With functional patterns, in so many words, you connect the myofascial slings, you release any tension that was created, bad tension. I'm just giving y'all a summary. You release any bad tension that was created in your body, and then you just reconnect the myofascial slings so movement can be more proficient. That's why we say resourceful exercise. Anybody can sit here and do push-ups, do a lunge, an isolated movement, but the body works together. So why not move and work out as one, not individual parts? So that's when the functional pattern comes into play. I really like this wall a lot. This was a good job, Jess.
I was going to say, a lot of these, our activity wall, as he said, it really goes to the resourceful exercise part and movement proficiency, because as you get recovered through restorative body work and hands-on manual therapy, this is really, really important for the aftercare, and as people go through sessions and things like that. It's really key. It's really important to put strength back into the muscle. It's really important to be able to move, but move correctly, and be functional and be okay with your body moving as one, because that's how it wants to move. Your body's able to heal itself, and these are just resourceful tools that we have that is able to make your everyday living a lot easier.